Diagnosed diabetic. No more sex. Impotent. No more driving a car. Possible blindness. Could be gangrene.
I've tried orthodox medicine and alternative routes with no result in different countries. Basically, what people say, you have diabetes and there's no way out of it. And this is very, very depressing for all of us.
Have you ever asked yourself why we haven't yet found a really successful cure for diabetes? We'd like to introduce you to Dr. Tamara Voronina. Her procedures are based on the training she received in Russia from the same people who trained Yuri Gagarin and the early Russian astronauts on their voyage into outer space. She was the first person to introduce the revolutionary mountain air therapy into Britain. This therapy or training was developed during scientific research into the problems posed by a space capsule environment. A senior endocrinologist at a major regional hospital in Ukraine, Dr. Tamara opened a London practice at the Arterial Disease Clinic in Wimpole Street in 1993. Having studied at St. Petersburg, Moscow, Krakow and Kiev, she's carried out biochemical and clinical research into the effects of fasting and intermittent hypoxia therapy, in particular relating to obesity and diabetes, by combining complementary and orthodox medicine. Diabetes type 2 is an example of complete desynchronization of metabolism. She says,
rhythm disappear. We became look like this. If we look like this, we're dead. We need every day, we need frequency. We need frequency in our cells, membranes. We need frequency working with our heart.
We tend to ignore the natural rhythm in our lives, and therefore desynchronization is the reason for so many chronic diseases. The medical world, in looking for new drugs, increases this chaos even more, creating a vicious circle. Daily dark and light, hot and cold, exercise and relaxation, food intake and fasting. All these desynchronize as well as synchronize the body's metabolism. The oscillation found in nature can facilitate the healthy rhythm of life. The greatest synchronizers may well be food intake and insulin administration, as well as oxygen and glucose oscillations.
We look like factory working, just we take food, it look like factory. Nothing happened. We even can't take energy from this food. We just became empty.
When I first started my treatment with Dr. Tamara, I used to be very hungry before I started. All the time I was hungry.
She is a classic case of the type 2 diabetic, but unfortunately she has a syndrome really, which we're now calling the insulin resistance syndrome. Because although she is having insulin to control her blood sugar is still not well controlled in spite of very high doses of insulin. In fact, she's been as high as 180 units of insulin a day. So in order to try and overcome this insulin resistance syndrome, we asked Dr. Tamara to help us with this.
Daily acupuncture can act as a hormone oscillator. Appetite is a specific hormonal condition, reflecting insulin-glucagon balance. Acupuncture can reduce appetite significantly.
With this treatment, I haven't felt hungry, as I've said before, and in the early stages, for 2 weeks when I was able to keep up the regime very easily, I wasn't hungry at all, and I lost a lot of weight. I lost over about 5 kilos.
So not only has she lost weight on this regime, but she has also decreased her insulin requirement from a maximum of 180 to about 50, and sometimes as low as 20.
What exactly do we mean by controlled fasting? Well, fasting should begin from a basis of normoglycemia. Fasting eliminates the food as a source of toxin in the body, An increase in the number of receptors to insulin is the main effect of fasting. Look at the following facts. On each lymphocyte cell, the norm is 6750 insulin receptors. Diabetics type 1 and 2 without obesity, 3680. Diabetics with obesity, 2300. Fasting for 72 hours increases the number of insulin receptors up to the norm. 80 hours after the ending of fasting, the number of receptors returns to the previous level. Regular morning fasting is necessary. This needs discipline, but the result makes it worthwhile.
I was able to lose something about 20 pounds in about maybe 1 month. And with very little pain. The method she uses is very effective with me in curbing my appetite.
Insulin should be given at lunchtime or in the evening, and food intake, monodiet lunchtime and evening.
Well, I've been taking up to 80 and more units with no result, actually. In a week, I've gone down from 60 to 65 units down to 25. With better results, which is quite incredible.
Why go against nature? The use of insulin during the early morning is much less effective, whereas it's the most effective at the time when its introduction synchronizes with the body's biorhythm.
When my urine was tested, it was the first time in a long time, I'm talking years, that there was no sugar in my urine.
I had very high sugar levels during the day, especially after lunch and dinner, and this hasn't happened again. I managed to keep a very even level, so that has really changed my attitude to life in a way.
So what does this training achieve? Well, a number of things. The stimulation of synthesis and secretion of insulin in pancreatic beta cells, also an increase in the number of capillaries in the pancreas and liver, a decrease in toxicity. It increases cytochrome 450, an antioxidant effect, a decrease in free radical activity, an easier entry of oxygen into the cells of the tissue, the formation of nitric oxide, relaxation of the smooth muscle of the intestine, leading to a general relaxation and the relief of stress. Therapeutic stimulation or training by oxygen oscillations may increase the number of insulin receptors and or resensitize them. The result of the consumption of oxygen and glucose is greater efficiency. Therapeutic stimulation, or training by oxygen and glucose oscillations, provides modeling of the most efficient structures for oxygen and glucose consumption. The method consists of the body being trained to accept a swing regime of delivery and deprivation of oxygen and glucose. Thus, a rhythm is established and insulin receptors on cell membranes are greatly increased. These oscillations are tuning cell membranes and their receptors. Less O2, more affinity to O2. Less glucose, more affinity to glucose. Less insulin, more affinity to insulin. As a consequence, the most efficient consumption of oxygen and glucose is achieved.
For treatment, important to put patient in particular rhythm of breathing. We do swing up and down, up and down.
The swing of oxygen and glucose between deprivation and delivery can most efficiently influence regulators in increasing sporting performance as well as rehabilitation of chronic disease. Even when we have a patient on a particular diet, we strongly recommend that food is taken at the same time every day. The same when treating with acupuncture. We're careful to maintain a special regime, working every day with particular meridians, bringing oscillation to particular parts of the brain and influencing particular hormones. This can prove extremely effective with results.
I came to see Dr. Voronina in January of 2000. So now it's March, it's about 14 months. I've had no problems. My blood sugar has been normal. I think I came to her maybe 15-20 sessions over a 2-month period.
So I think that there is this whole concept of trying to upgrade the receptors on the cell surface to receive and use insulin better is a very interesting and important way of trying to tackle the insulin resistance syndrome.
So, how many cases has Dr. Parry seen that have been successfully treated by this method?
I've seen 6 or 7 with Dr. Tamara.
Regarding my legs and feet, sometimes I feel I am getting some sensation back, and I feel I can sense temperature changes, I think. So I hope that we can work on that more and get more improvement.
We have similar experiences with other patients in which their insulin requirement is lowered with this regime of acupuncture, dieting and herbal replacement, and intermittent oxygen, low oxygen therapy.
I had 9 this morning, which I haven't had for years and years, and my sugar is quite stable throughout the day. My energy is also slowly coming back, and I'm really very, very excited and surprised about it.
I have a lot more energy. I seem to be able to do an awful lot more. Generally, I feel a lot better.
Last September of 2000, when I went and did my checkup, my doctor told me my results were the best, in fact, in the last 20 years that I've been going there. So anything from cholesterol, liver, or all of the tests were absolutely very good.
Those are just 3 of over 100 successful cases of Dr. Tamara Voronina's. If you want further analysis of her work or details, she'd be delighted to talk to you, and we can also provide you with a CD-ROM.